Report of the Auditor General on the Kilifi County Health Services Improvement Fund for the year ended 30th June 2022. It's a clean opinion. Under other matter 1, budgetary control and performance. The statement of comparison of budget and accrual amounts reflects final revenue budget and accrual on comparable basis of Kenya shillings 418,426,159 shillings and Kenya shillings 402,699,307 shillings respectively, resulting in underfunding of Kenya shillings 15,726,852 shillings or 4% of the budget. Similarly, the fund spent Kenya shillings 398 million 19,314 shillings against an approved budget of Kenya shillings 418,426,159 shillings, resulting in an under expenditure of Kenya shillings 20,406,845 shillings or 5% of the budget. Thank you, Chair.
Governor, your response.
Thank you, Chair. The county executive hereby concurs with the auditor's observations and makes clarifications as below. The budget amounting to Kenya shillings 418,426,159 was a projected budget and was dependent on the performance in revenue collection from the hospitals. We hereby confirm that the actual revenue collection did not match the projected budget. The financial year 2021-2022 had the COVID-19 pandemic outbreak. This greatly affected the health services delivered in hospitals and had a negative effect in revenue generation trends. However, in spite of the challenges posed by the COVID-19 pandemic outbreak, there was remarkable improvement in revenue generation trends comparatively from Kenya shillings 197,346,442 in the financial year 2020-2021 to Kenya shillings 402,699,307 in the financial year 2021-2022. On Chair, the under expenditure in the financial year 2021-2022 was an expenditure of Kenya shilling 398,019,314 against revenue collected of Kenya shillings 402,699,307, amounting to the under expenditure of Kenya shillings 46,679,933. On Chair, the under expenditure of Kenya shillings 46,679,933 was as a result of the recovery from the previous year's pandemic, which affected production of critical commodities all over the world. Consequently, the resources which had been budgeted for to procure these commodities were not spent because the said commodities were not available in the market locally. Some of these commodities included latex gloves and artemether-based drugs. On Chair, the problem is now addressed. The county executive is in the process of initiating an electronic management register to enhance Health Services Improvement Fund, effective implementation, administration, control, and governance of the fund. The electronic management register is in the process of validation by the users, which shall be followed by users training and subsequent rollout by January 2024. Attached as Appendix 10A in our response to this Honorable House's letter dated 22nd January 2024 and referenced SAN, DGSE, CPIC, SF, 2024/2, thereafter referred to as our initial response. Please find evidence of the approvals for the payment and evidence of the process of initiation of electronic management system. On Chair, we have further prepared and submitted an addendum with more information to support our response to this honorable House. I invite members of the committee to look at the Enterprise Resource Planning ERP management system at the Kilifi County Referral Hospital, contact documents which appear at pages 029 to 053 of Annexure 10A in the addendum for the financial year 2021-2022. On Chair, please note that we are now in the process of implementing a comprehensive enterprise resource planning APR management system at the KILIFI County Referral Hospital and thereafter in all the health facilities in the county. On Chair, the APR management system at the KILIFI County Referral Hospital was rolled out on the 11th day of August 2024.
Okay. Very well, Auditor, your comments on the response?
Chair, there is improvement in revenue collection by the assembly. It's only that last part I don't have, Governor. Whatever you are reading,
Yes,
that's additional.
We'll give you a copy.
I don't have any information.
It's on the addendum, so we'll give you a copy.
Yeah, I don't have. No, there's nothing. That report is not there. Whatever I was reading, I don't have. But from the original response is that there is improvement in terms of revenue collection, but still the element of under expenditure is still there. Thank you, Chair.
Okay, very well. Maybe Governor, you know I come from the IT background and I get excited when I hear some of these solutions being done. Maybe you can tell us more about the ERP and how it has helped you to improve revenue, and whether you have had this installed in all your key hospitals.
Chair, we have started the pilot project at the Kilifi referral, as I've said, but you can see the trends, and we have attached a document. We wanted to dare put a display if the committee would have allowed us, because it's amazing, Chair. I think in the last 10 days, we collected from 400,000 to 7.9 million in 10 days. That's only one hospital. You can imagine if we go to all 9. You can imagine our revenue collection in a year. Previously, even during my campaign, I used to say to the public, the issue where a pregnant woman is going for a checkup and they have to carry an exercise book. And if they're at home, they reach the hospital, they have to go back. Then they don't go back to the hospital again for checkup. So this is going to solve also not only on revenue collection, but on medical records of our patient. That you don't have any longer to run around with exercise books to show a doctor to refer to what you are suffering from or how far you have done your checkups. So, Chair, we have demonstrated there. You can check on page 126, Chair. Page 0126. You can see, Chair, how much money we collected by 20th, between total revenue collected between the period of 12th of August and 20th of August. 8 days. From 400,000, we're at 3.6 million, 649,739 for 8 days. Page 026. Yeah.
Chair. In the governor's response, he says that the county executive is in the process. In the governor's additional information on the draft, He indicates to the committee that he's collected 7.9, which is something which is, which is positive. I want a clarity. Are you in the process, or the system is up and running? What is what?
Yeah, it's up and running, Chair. We have started a pilot project, as I've said, at the KILIFI Referral Hospital. And these figures you have given, it's all the members have not yet all using the system. I think we have supplied like 25 computers out of 60. So if everybody now could be on this, log on the system, so we have started, but partially. So we are rolling out to finalize KILIFI, and then we move to the 9 other hospitals.
Okay.
Yeah.
Now, let me also get a clarity. In your regulations draft, it's in the financial year, the black document, this one, 2020. I was just perusing through your draft on the issue of user fees and charges, part 3. And I noted part 5 in the regulations draft. You had indicated that unless otherwise prescribed, the fees and the charges established by these regulations shall be payable to the county government of KILIFI, 1, by cash, 2, money order, 3, certified checks, debit card. My concern goes to the cash part.
Chair,
Maybe we can share my document.
Page what now?
page 2020, yes. I'm trying to get the page where the local member is reading. But it wasn't.
Yeah.
Chair, maybe I can clarify that. I have understood the question of the honorable member. That was 2020. We have since now moved. That was 2020, how they were operating. Now I've moved out of the cash and all those systems, and we'll have one system through the EMR. Yeah.
Okay, noted. My last question is to the auditors, Chair, through you. Auditors, did you tell the committee who assigned the financial statements?
Maybe that one. You know, all the reports are unqualified. So I don't think that will be very important.
Chair, you're reading my mind.
Yeah, I know where you are heading to. You are an expert in that area.
Get something from maybe the governor or the auditor. What happens because this issue of budgetary control appears also in all the other funds, the counties that we've seen. What is our recommendation if towards end of the financial year, I expect that maybe the county, if they have realized they're not hitting the target of proposed budget they had, is to do maybe a supplementary budget so that, they at least cover that, they ensure that they're within what they have collected, the budget for it. And then the other programs they're supposed to do above what they didn't collect. And then it should have been sorted out as a supplementary budget towards end of June, towards end of the financial year. I don't know if that's something that you need to propose or something.
Yeah, can I do a rider to that question? Chair, with the permission, thank you. It's quite sad that we want our people to get sick so that we can collect more revenue in the hospitals. Auditors, should we then, just like my brother said, should we ask the county not to do projections? When it comes to the issue of their planning budget versus the actual budget. Because then if you raise that query in the budgetary performance, and you are saying, and I was waiting to talk to the auditor, because they say they have improved, but they still haven't gotten to that level. So do we want more people to get sick? Or to give birth? So I think auditor,
Yes, sir.
on a very serious note, we have to come up with a different sort of like system of auditing health facilities. I don't think we should cut and paste in all other aspects. Because if you are looking at the executive audit, there are businesses that are coming up, okay? If you look at it, so there are licenses, there are plot rents, there are all that stuff. But this one really, maybe you may need to sit down with your office and have a conversation with yourself and say, maybe we should not raise this issue because unless you really just want more people to die, so they pay for more services, more children to be born, more people to get sick, it's going to be difficult.
Chair, maybe if I may comment on, I hope it was not a question, but I want to comment something on that we are not only waiting people to get sick. Chair, in Kilifi, we enacted the Kilifi County Community Health Services Act 2023. And this was primarily for giving stipend. If even the national government was thinking to come up with stipend to the CHPs who are called community health volunteers, Kilifi, we had gone ahead, we were ahead of the national government. And the idea was to give stipend to the community health promoters or volunteers who are called then, so that we can deal with the health primary care, so that we don't get many, we can prevent diseases and sicknesses. So to the member, Senator Olekina, is that we don't just want people to get sick. That's why we have 3,385 health, community health promoters. And we have budgeted this financial year 90 million for them. Okay. It was not a question. I just wanted to say, doing more than what he thinks we are.
So, Senator Mutinda?
You know, Chair, I was still waiting for my response from the auditors because we also need to appreciate these good accountants, if you are reading my mind, as much as we've corrected, because I'd be happy to note that this issue is actually getting sorted. Because I think the accountants are now talking in all the 47 counties. And I'm happy that I'm doing my job then very well.
Yeah. Okay, thank you.
Auditors.
Yeah, so maybe the only thing I wanted to find out from Governor, the way this system, you know, we have seen challenges in law between the county law and the national law. Now, I'm seeing we may also have a problem here because the new act, the Digital Health Act, provides that there will be a system that will do a number of things. So how does this ERP sit within that Digital Health Act?
Let the CEC explain that. I think it has been a subject we have been...
Yeah, this is, thank you very much, Honorable Chair. What we've been discussing at the national level on this particular act is that the national government is developing what we call the superhighway, which enables the different programs or the different systems to be able to link to the national system. So in developing this system, we worked very, very closely with the ICT team at the Ministry of Health to make sure that this one is actually in sync with the digital superhighway, so that information that is generated at our hospital is able to be seen at the national level.
Chair, if you allow me,
Proceed.
I'm a strong defender of counties, and health is devolved. So I think really it behooves us to be able to make sure that we separate these two. National government is coming up with all this legislation just to try and claw back on devolution. So I think we should push more for counties to develop their own. Even that that Digital Health Act, what was it called, digital what? The Digital Health Act, the Facility Health Improvement Fund, I think those ones, we will definitely must now come up with amendments so that those counties that were still lagging behind can be able to either utilize that or set up their own following the guidelines of that. You know, because for me, I see a problem where every time we sort of like go to the highway created by the national government, we are clawing back on devolution. So that's my take on that, Mr. Chairman.
Hey, Chair, while we were in Turkana, a lot for Senate Mashinane, we visited as ICT committee. I don't know if you were part of that team, Chair. That, Turkana County Rivara Hospital, they have a very good system. They even collaborate with MTRH and KNH for the expert doctors to assist in terms of diagnosis and even prescribing. Chair, this thing called the super highway, digital super highway by Minister of Health, I agree with Senator Nakina. We should not allow national government to interfere with the counties. If Kilifi already has a system, they can maybe hook on to enhance what they don't have. Otherwise, Ministry of Health, basically these are, they still have a lot of, there's a lot of money remaining at the national level that should be going to the counties. And let me tell you, I don't think they even have a system as we talk of now. They don't have.
They're just engaging our county CCs of health I think they have meetings like every 2 weeks.
Myself and the chair, that's our area of expertise. These guys don't have a system. And if you're not careful, it will go the merit equipment way, scheme way. It's just a scam. Yeah.
Thank you.
What I want to assure you, Chair, that nobody has stopped us from using our system. Will continue, and anything we get better, which will improve our revenue collection, we will budge on the superhighway. But for now, our system is on, and we are moving on, and we are not looking back. Thank you.
Okay.
So I think we're about to finish. I was also saying maybe it's good for you to give one of the MCAs opportunity to say something.
Yeah. Yes. No, wait. So I think this query, the explanation that has been given by the governor, it is something we will review how it works out in the next subsequent audit cycle. I think we've reached the end, but honorable members, we've taken the shortest time on this, just to put on record that we had also wanted to look at municipalities, but governor requested for more time to work on the municipalities. That is why it is not on record here. So municipalities will plan for another day when they have they are ready with the responses. So I think we have come to the end, but before we conclude, just final remarks. Members who have final remarks. If you don't have any final remarks, you can allow us to finish early. So, any final remark? MCA, you can say something. Honorable member of the County Assembly.
Minority Leader will represent them.
Thank you, Your Excellency. Chair, I want to thank you for this opportunity. And on behalf of my fellow MCAs here, the majority and the deputy majority and the deputy majority whip, I also sit in the PIC committee together with the deputy majority. I also happen to sit in the health committee. And I'm happy to have witnessed the deliberations here. These are the same issues we have been dealing with at the county assembly. And the Auditor General team that was present at the county assembly, I'm happy the coordination that we've been having. And whatever has transpired here, it really inspires us even to do more at the county assembly. So we thank you, and we are happy to witness whatever has been happening here. Thank you very much.
Very well. So, Governor, your final comments?
Thank you, Chair, and I want to thank you for indulging us on the municipalities, and we hope when we come back we will have enough paper to present to the Assembly. Chair, what I want to say is we want to thank you. Every appearance here makes us better. But I want to assure you, on the health sector, I'm very passionate about this health department. And I want to assure you, by the time we appear next year, I want Kilifi to be #1 in this country on health services and improvement, which are really undertaken. You have seen me going around the last months in different countries in the world looking for partners. So I'm sure very soon we'll get a better system than you see today. I was telling the CEC and the chief officer that they cannot tell me 500 million. I have not yet, it's not in a performance contract. I told them, this is your performance contract, mine to you is X amount. And we can get it, Chair. You have seen in 8 days what you can collect from 400,000. So it's possible if we seal all the loopholes. The next one is drugs, where all hospitals, I think, or all countries are suffering from. We need to find a solution on that. So anytime you come and give us your opinions and input, it makes us improve. Thank you very much, and we will always be happy to appear, not to be grilled for wrong reasons, but just to share what we have been able to do and improve on our services. Thank you very much for having us today. Thank you, Chair, and the team.
Thank you. Mine is to thank you for honoring our invitation. Indeed, you are one of our good partners because this process is a partnership. So we are indeed glad for your appearance today. We also want to recognize the efforts that you have made in on-source revenue improvement in the hospitals after the automation process, but we encourage that more should be done. We will also have an opportunity to look at the reports for the individual hospitals when they are availed to us after the signing of the audit certificates. Otherwise, we wish you well and safe journey back home to Kilifi.